But at the end of the day, that's all we're encouraging is the fact that we want these pharmaceutical companies that have allowed the American free market to help them thrive and the American consumer to help them get where they are. Let's prioritize the American consumer, right? Let's make sure that the American consumer is not the only industry where you're making your profit.
See, when it comes to medicine, I don't know that anybody goes to the doctor and says, I want 10 prescriptions.
Oh,
You know,
I think we are dealing with that though.
well, they go to the doctor looking for solutions, and the doctors are paid by Big Pharma to provide a medication that may or may not treat that solution. And there's all sorts of efficacy and there's all sorts of cause and effect that go into this. But I want to be clear because government does need to regulate some industries.
Sure.
And the immunity that Big Pharma receives on many different levels because of all those layers and being so intertwined with our government, I think is wrong because it diminishes accountability.
It diminishes accountability, but also we have to look at it at how are they manipulating the levers of government to continue to grow their profit.
Yeah.
Right. And so one of the things that I think about when we're talking about this very issue is we're one of the few nations in the world that allow to direct to consumer advertising for pharmaceutical drugs. And so to your point, we as patients should be going to our doctors looking for solutions. We should be able to have that conversation with our doctor. This is what I'm feeling. This is what is happening to me. What's the best course of treatment for me? But because we're getting television ads pointed our way and we see this fairy tale, oh, I wanted to open a juice bar, but I had this skin rash and it prevented me from chasing my American dream. But I took insert drug name here and my skin rash went away. And now I have a thriving juice bar business. Go to your doctor and ask for this.
You know what? Gag me. And
Right.
I get it. That's advertising, but gag me because guess what? You just talked about a very expensive way
Yeah.
of marketing.
Yeah.
And there's a difference between need
And desire.
and desire. We can go into a lot of drugs that deal with desire.
You're right.
Some of the fastest growing, most profitable drugs in our country are based on desire.
You're 100% correct.